I think as doctors and healthcare professionals, patients expect us to ask about their smoking, and they think if we don't, that it's not important and it doesn't matter. I think we've all got a duty to ask about it and help show them what support's available, whether that's just for the time that they're in hospital, to give them the products they need to help with cravings and withdrawal from nicotine and tobacco dependence, or whether that's going on to a sustained quit attempt. Sometimes when patients are first admitted to hospital and are asked about stopping smoking, they feel like they're being put on the spot and they lack the confidence to think that they would be able to make a successful quit attempt. But it's really everybody's business who's looking after them while they're in hospital throughout their care journey to keep motivating them, offering them different tips and advice, products and support. As a respiratory specialist, we see a lot of patients who are repeatedly admitted to hospital with exacerbations of their airways disease, such as COPD or chest infections, or where they're needing machines to help with their breathing because they're in such a precarious state. For those who are able to make a quit attempt, it has such a powerful impact on how often they're readmitted to hospital, and we can sometimes break a cycle of people keep coming in and out and having treatments and give them some really good quality of life back.
It's so exciting to have Trust in the northeastern North Cumbria setting up brand new tobacco dependency treatment services as part of a life-saving intervention for smokers who are admitted to hospital and as part of routine maternity care. We've known for a while that smoking is a relapsing chronic long-term condition that starts in childhood. But now the NHS is saying now is the time to prioritise prevention. And we know also that this support for smokers can go a long way to reduce the pressures that the NHS faces during winter. We know that smokers are 5 times more likely to develop influenza compared to non-smokers and may experience worse symptoms from flu and COVID. In my role in the region, I've been encouraged by the enthusiasm showed across the board by NHS Acute and Mental Health Trust in delivering on the smoking ambitions of the NHS long-term plan. I really look forward to continue to work with Trust exec sponsors, clinical and smoke-free leads, and members of the public health teams in local authorities and indeed the wider ICS system as we continue to strive towards our 5 by 2030 ambition to make smoking history.
So the tobacco dependency treatment service is in an ideal position to treat patients at a moment in their life where they may be ready to make that change. We understand that they're in a stressful situation, they've been admitted to hospital and they're poorly, but that could be the teachable moment that allows them to make that change. We also believe that early recognition of identifying a person with tobacco dependency is vital. Prompt treatment, showing empathy and understanding. Tobacco dependency isn't a lifestyle choice, it's a medical condition. It's a chronic and relapsing condition that should be treated with the same importance as any other treatment in the hospital. And that's what we aim to embed across the Trust here at North Tees. So within maternity, prevention is the key, and early identification of smokers right from registration of pregnancy. We're picking up those ladies that require tobacco dependency support. So we've got lots of great support available for patients with tobacco dependency here at the Trust. What we encourage through training is for all members of staff at all levels to ask a person's smoking status on admission. That way we can link quickly into the service that's available, provide a nicotine replacement therapy as soon as possible from admission to really prevent patients struggling with the discomfort of nicotine cravings. And the great thing that we can do with the tobacco dependency service is once we're referred in from that point is really have the time to sit down and make a personalised bespoke plan that's going to suit that person and their individual circumstances.
I have tried patches before, but it didn't work for me, but I think that was all down to psychological and hand-to-mouth habit. This is the first time I've used a vape, and I've found it loads easier. Massive difference. I can smell my perfume. Food smells gorgeous and tastes gorgeous. My cough is totally gone. It was waking me up during the night and I'm sleeping solid now. So it's all positives really. Been excellent with me. All the girls have anyway because they make a point of asking how you're doing as well, which I think makes a massive difference as well. It shows commitment, doesn't it, you know? Definitely contact them and I'd definitely recommend them. For anybody who's thinking of quitting, give it a go. I feel loads better, well worth it.